We are so excited, thrilled, and honored to have with us a very special guest. This guest is no stranger to our organization. They've been with us before. And we have been in conversations with this individual for quite some time. And so his presence today is certainly timely, and it is relevant. And we sort of identified this date a long time ago. And with everything that's going on with the COVID and the Delta variant, it is just so timely to have this individual with us today. So I am speaking of none other than Gerald Dyer, the Communicable Disease Epidemiologist with the Benton County Health Department. Gerald has worked at Benton County Health since 2014 and is currently working as the Benton County Health Communicable Disease Manager. He was born and raised in Louisiana. All right now, Southern brother. Gerald spent most of his childhood in a small town with only 4 streets. Gerald is a first-generation college student and completed his Master's of Public Health degree focused on epidemiology at Tulane University in New Orleans, Louisiana. He and his family moved from Louisiana to Oregon, where he could work as an epidemiologist while ascending or working on his PhD in public health at Oregon State University. Wow. He and his lovely wife are parents of 2 young children, a 5-year-old and a 4-year-old. Please help me welcome back to our awesome membership meeting, Gerald Dyer. Welcome, Gerald. Thank you for being with us.
Thank you once again. I really, truly appreciate the honor. It's actually humbling to be invited back. So I must have did something a little decent last time. So thank you all for having me. I appreciate it.
Thank you for being with us. All right.
Would you like me to get going? I wasn't sure.
Oh yeah, yes, yeah.
Don't want to speak out of turn or anything. By the way,
no.
them four streets in Louisiana, just so you know, they call First Street, Second Street, Third Street, and Fourth Street. That's how I got real good at math, counting the streets I lived on. So thank you so much for having me. I'm about to get going with this presentation. All right. And this is going to be what we consider a surveillance draft. So I get these type of updates to our team and the county internally on a weekly basis. So once again, it's an honor to be able to share this with you all and with the group. So I'm gonna get going. I only got one screen. I thought it'd be better to have one screen. So I'm trying to put the chat over here. All right, technology. All right, so here we go. So once again, I'm Gerald. I'm a communicable disease epidemiologist with Benton County. I'm also doing managerial work at this time, doing a COVID response. And I always like taking a moment to wish everyone the absolute best of health during a pandemic. One thing that I really wish for everyone, those who've been directly or indirectly impacted by the pandemic, is the best of health. Because once your health starts to go, everything else starts to break down from a holistic point of view. So I really wish you and your family the absolute best. And thanks again for having me. So the presentation topics today, we're going to talk about just some brief epidemiological terms. These are terms that if you're ever looking at epi-data, they'll just be helpful to know during the presentation. I like taking my presentations from a global perspective first, because during a pandemic, until COVID is, I guess, under control, or more people have access to healthy interventions, vaccinations, even masks. There are countries who don't even have access to masks. So from a global perspective, we definitely will have to make sure that the entire world is healthy. Otherwise, this global pandemic will continue. And from there, like going down to the state level, we'll talk a bit about Oregon. And then we'll talk about Benton and Linn County. Last time I gave this presentation, I focused on Benton. And I was told that people also want to know what's going on in Linn County since we're neighbors. So I put a little Linn County data in here. We're also going to talk about Benton and Linn Oregon monthly rates. And these rates are going to be more along the lines of, just standard crude rates. We didn't do any age adjusting for this particular one, just give you an overview of what we're seeing on a monthly basis throughout Benton, Linn, and also the state of Oregon. We're going to talk a little bit about the Delta variant. This particular variant is more transmissible than the previous variant known as Alpha. And then we're going to touch upon the health disparities that have been wrought throughout this pandemic. And also, at any point, anytime, I gratefully have people who are able to moderate the chat for me. If you have questions or concerns or any insight you want to share, please feel free to share it. I like presentations being more of, a conversation that we have with each other, more along the lines of just listening to me. I know people like to think I'm some type of expert, but quite honestly, I'm always learning every single day, not just with communicable diseases, learning how to be a better father, a better son, it's a better human being. So feel free to answer questions, and no such thing as a bad question, anything like that. Presentation is not meant to shame anyone. It's designed to give people more information so you can make a more informed decision about the health of yourself, your family, and community. So key epidemiological terms. Thank you. Thank you. Full disclosure, my daughters are in the room. I'm in their room, so if they run in, technically this is their room. My apologies up front, but full disclosure, I'm in my daughter's room giving this presentation, and things tend to happen. So a confirmed case is a case that is simply someone, if you ever go get a COVID test, these confirmed cases are people who test positive for coronavirus. So that's what we mean by confirmed cases. You may see data that gives information about, okay, this is only confirmed cases. In that instance, that's what they're talking about. They're telling you these are people who actually got tested. There's two primary tests. One is a PCR, which is a molecular test. The other one is an antigen test, which is mainly they're looking for proteins to determine if you have been exposed to COVID. And the antibody tests are those ones that are really the rapid tests. Most time they're not that sensitive, but with the Delta variant, because it's more transmissible, they have potential to be more sensitive than they were at the beginning of the pandemic. And the presumptive cases, simplest way to put it, is a whole complex definition for this. The presumptive cases are people who've been exposed to COVID. They haven't been tested, but they have COVID-like illness. A standardized rate. Oh, in this presentation, you're going to see people talk about rates per 100,000, or you may see age adjusted rates. That's what we mean by standardized rates. It's just another way of comparing different counties, different age groups, different populations, different states. Epi curves are going to be the big basis of this particular presentation. These epi curves are going to be what you see at the beginning of the pandemic, and then you're going to see what they call a surge. Right now, we're in what's called a fourth surge of COVID, meaning there have been 4 spikes in the cases that cause increased illness and transmission throughout the community, and also increased deaths, unfortunately. And a health disparity, and that's the simplest of term, but there's nothing simple about health disparities. That's going to be along the lines of, particularly if you look at it broken down by race, African Americans are 2 to 3 times more likely to die from COVID than others in the population. You can also look at it by age. For instance, population that are 20 to 19 make up about 16% of the population, but they account for almost 25% of the cases during the pandemic. That's a health disparity. So let's jump right into it. This is the global perspective. So last time I did this presentation about a year ago, there was about 30,000 confirmed cases. Right now it's 200,000. So that's about 7 times what it was last year. And unfortunately, when you have more cases, that associates with more deaths. So this time last year, we were sitting around 2 million, 100 million deaths. So that's pretty much doubled. There was no vaccines available to protect people from COVID. But so far globally, there's been about 3 billion vaccines. But unfortunately, one thing that's showing on this next slide is that the distribution of these vaccines on a global level is inequitable, meaning there are entire countries who don't have access to vaccines. There are countries who don't even have access to masks to protect themselves from a global level. What that means is that our entire world is hurting. And until we begin to help one another, this pandemic will continue going forward indefinitely, unfortunately. So this map is from Johns Hopkins. I think it's good. We're going to share these PowerPoint slides, and each one of these snapshots are going to be available. If you're interested, you can use the links. They update this hourly. So let me tell you, after this presentation, all this is going to be outdated because there's going to be more cases, going to be more deaths, unfortunately, but also more vaccinations. So there is hope, right? Even when you're going through the hardest of times, hold on to that hope, hold on to that faith that you can get through difficulties. And, that's where we are. We're going through hard times, tragic times. But I encourage you not to give up on yourself. Don't give up on your family. Don't give up on your community. Don't give up on your planet. We're going to take it one day at a time. One thing I want to point out with this particular graphic that United States is one of the countries that have been hit the hardest during the pandemic. Over 35 million cases and over 600,000 deaths thus far. And this is data that was based on when I did this presentation from last week, because I try to get these presentations done a week in advance, work out the bugs and the kinks. So unfortunately, all these numbers are increasing, but hopefully the vaccines are increasing as well. More protection for more people, protecting of life. So this great infographic for Johns Hopkins, this is the one I was telling you about. So if you look at parts of Africa, there's pretty much no vaccines available there. Australia even struggling. Some of the Asian countries are struggling. So from a global perspective, till there's more vaccinations, until the world comes together to help one another, this pandemic can go on indefinitely. And that's one of the reasons that we're having this variant called the Delta variant that's wreaking havoc, not only in America, but across the globe. Because the more COVID is allowed to transmit, it's thought that it mutates every 7 to 14 days. So that's every single day is trying to take out humanity. So with the masking, the distancing, the vaccinations, it gives us a fighting chance so that more people can be healthy. So this one, we're going to take it down to United States at this point. So last time I did this presentation, America had about, let me move this out the way. Sorry, that bar's in my way. Hopefully you don't see that bar, by the way. We are sitting about half the amount of cases that you see, and also half the amount of deaths. So a year later, everything is doubled. We did have a point in time when the cases were decreasing, but unfortunately we're in this fourth surge of cases, meaning there is more deaths, there's more transmission, more cases. All right, so this right here, I think is it's more timely. I think it's all timely, but you take anything from this particular graphic. This is community transmission. And this is from the CDC. And the way CDC defines high transmission, if you do a standardized rate, anything above 100 per 100,000 rate is considered high transmission. And like I said, this was pulled last week. Week later, pretty much all of America is in the red at this point, meaning that this Delta variant is causing severe community transmission throughout the nation. All right, so here's what I mean by an epi curve, epidemiological curve. And the next couple of slides are going to focus on these. It's from Oregon Health Authority, and all this data is accessible. So if you want to stay up to date on how COVID is impacting the state, the nation, the world, all this information is available. Hopefully I can break it down in a way that makes sense. So at the beginning of the pandemic, if you can remember, there was no test for COVID. That's why you see such low numbers here. We didn't have a way to diagnose COVID. There was no COVID test. And the only way you can get a COVID test was if you were almost hospitalized on the verge of getting intubated, unfortunately. Intubation is when they take the tubes and your mechanical ventilation. That's when you get to a point where the likelihood of survival starts to decrease per day the longer you're in the hospital. So here's what I mean by the peaks. I don't know if you can see this mouse or not, but here's a peak. And then September and October, the fall and the winter. That's when all respiratory pathogens, the flu, norovirus, influenza, they tend to impact humanity on a higher level during the winter. So this is the biggest peak that we experienced thus far in the pandemic. And then it went down, summertime, masking, the distancing was all in place. And then once we hit the summer, there was also another peak, not as drastic as the one in the winter. More people were getting vaccinated, and as you see, it went down. But unfortunately, now what's happening, this new variant emerged pretty much around May, June, and this variant called the Delta variant is so much more transmissible. It's almost at the level of chickenpox, varicella. I don't know if anybody remember chickenpox, but if you're with your cousin and they got bumps on their face and it's not pimples and it's chickenpox, everybody in the house got it. So that's how COVID is spreading. Initially, it wasn't spreading at that pace, but now this Delta variant spread the same way that chickenpox was spread without vaccination. So we're getting to a point where if you see this peak right here at the end with the green box, that peak is starting to get higher and higher. Oregon experienced the highest cases ever during the pandemic about 2 days ago. And the way things are trending, it's going to be very challenging in the winter and the fall. But like I say, there is hope. We just got to make sure that people, if they are into getting vaccination, they have that option. They need more information about it is there. The mask mandates are starting back tomorrow. All that's in place in order to try to protect people, because we have entire populations. 10% of our population 11 and younger have no access to any vaccine, so there's no protection. So if they get exposed, what we're starting to see is that the hospital, the pediatric kid hospitalizations are increasing as well. What you didn't see so far with the pandemic with the Alpha, but so far this Delta variant is attacking everyone aggressively, irrespective of age. The vaccines are holding, so that's the good news. But if there are a population, like I said, the younger people who can't get vaccinated, and there are populations in the world who clinically just can't get a vaccine, like they depend on others for that type of protection. So this is the Benton County epi curve. This is the curve per day. And anytime you see the orange, that represents people who are symptomatic, meaning they got ill after their exposure to COVID. The grades are just unknown. Sometimes, you might not be able to get that information, unfortunately. And you also see the blue or asymptomatic. So asymptomatic, most of the people in Benton County anyway, are symptomatic. And it's the same trend, right? You see a small peak, and then you see a big peak, and then it goes down. The third peak, that surge. And now we're in a fourth surge that potentially could go through the fall and the winter seasons. Linn County, pretty much the same. Once again, started low because the testing wasn't there, the resources wasn't there. And then you have a initial peak, and then you have the huge peak during the winter, the fall and the winter months. It goes down, get another peak in the spring. And once again, we're on our way up, peaking until we're not even, this is late summer. We're not even in the fall and the winter yet, and we're already seeing levels that we saw back in January. So, like I say, with the trend has been pretty consistent, and they are starting to increase. These particular infographics go up to July, but just want to give you all a heads up. Already in August, we're only 12 days in, has surpassed the people infected by COVID from July. So this peak right here is going to be even higher in in August. And once you get to a point where you're peaking, like in June, the cases was so low. But then July, it tripled. You're talking about triple the amount of infections in a period of 14, 21 days. And it's only increasing thus far once we get into the fall and the winter. So these are rates. Once again, remember, anything above 100 per 100,000 means you're at elevated risk for COVID. The transmission is elevated. January, you see these rates per 100,000, and just to give you probably more information than you need, but these rates are calculated using Portland State's population estimates for the state of Oregon, for Linn County, and for Benton County. So I mean by standardized, you take a population, and the simplest terms, you take the amount of cases per month, divide that by the population based on a standardized or certified estimate. Then you the census, because the census was pretty much just finalized today. So these are Portland State population estimates to determine these rates. And so in January, Benton County, as you can see, followed the same trend, right? The peaks and the surges. There was a surge during the winter. It started to go down a little bit in the springtime, started to decrease. See, in April, I started to decrease a bit. May it decrease. June, but all the restrictions that we have, restrictions, protections, tomato, however you want to, verbalize that. We have protections. More people getting vaccinated. The case rate went down. It's 82. Anything below 100, that's what you're looking for. That's more protections for everybody in the community. But then what we call the incubation period for COVID, that's 14 days, 2 weeks. Within 2 incubation periods a month, you see this rate 82 jumps up to 259. And going into August, we may surpass the rates that you see right here in January. So increased transmission, not only in Benton and Linn, but also in the state of Oregon, unfortunately. Also, one thing that these increased cases and deaths mean is that the hospitalizations, the hospital capacity is lessening. And so in the state of Oregon, we're already at 90% capacity for ICU beds. And that's with people mainly who are unvaccinated, exposed to this Delta variant. And once your hospitals fill up, what that's going to mean, I'm not wishing ill on anybody, but fresh in my mind. Okay, I'm gonna tell you, my wife broke her leg, right? It's if broken legs are on my mind, sorry. But say you break your leg, right? And there's no bed availability for you. You're gonna be sitting in the ER, or worst case scenario, like in Louisiana, where I'm from, they're putting people in football stadiums because there's nowhere to put people. So that's what, when these rates increase and these cases increase and these deaths follow it, that's what that means. The hospitals in the state of Oregon are already at 90% capacity for the hospital beds. So anyone who needs care, even if it's non-COVID, may not be able to get it. So let's talk a little, we're gonna switch a little bit, talk about this Delta variant. This Delta variant is primary reason why these cases have skyrocketed throughout the world, quite honestly. First time we heard about it, we wasn't sure where it truly emerged, but when it was first reported, it was back in December in India. I don't know if you all remember the news about the number of people in India who they had to cremate because there was no hospital bed, there was nothing. They just had to cremate people in makeshift fields because a lot of people were dying. Their rates were increasing and people were dying. So what happened is Delta variant emerged, well, first reported, remember, emerged doesn't mean that it wasn't here, right? It just when we first was identified in the US was in March, Oregon, April, Benton County. We actually did some genotyping with the state lab in July. And now this is the dominant variant in Oregon. It's the dominant variant in America. And it's the primary reason why you see so many people being hospitalized. And so, you know, I'm gonna say this. Research always improving, right? If you ever learn anything about the pandemic, you learn more and more every day. Everybody's pretty much at the same level of knowledge. That's why people who say they're experts and they know everything, yeah, you won't hear that from me. We're learning every single day. So it's thought that this could be 3 times more transmissible. But there was a study done in China showing that the viral load of people, whether was like 1,000 times more than the alpha variant. So that's a huge range, right? You're talking about confidence intervals, 3 to 1,000, you know, times more transmissible. But what we're showing is that Delta cases, there's much higher level of virus. Once again, 1,000 times more than the alpha. And what that means is more transmission. I'm saying the vaccines are holding, but if it continues to mutate, it continues to grow stronger per se, um, the entire humanity of vaccines. That's why you see people talking about booster doses. It may be needed because this Delta variant is so much more aggressive. Still trying to figure out, like, does it cause increased severity? We're not sure, but it is showing that it is transmission regardless of age group, and it's attacking people who are not vaccinated the most. CDC reported 98 to 99% of people that are hospitalized are dying, unfortunately, are not vaccinated. And it's sad because things can be prevented, right? This trying to make it so people can live. So it's about protecting life. That's pretty much what it is. If you have life, I think it's something that's precious, something that we should all cherish. And the healthier we live, I think the better off. I mean, I know there are barriers in life. It's discrimination. It's unprovoked hatred. But you can find something positive about your life, something worth living. I encourage you to find that, live your life as happy, as healthy as you possibly can, because it's ephemeral. It can be gone tomorrow. So getting back to the Delta, so the main concerns that we're seeing unvaccinated at this point means there's no protections. I can say uh, people are being stretched out on football fields because the hospitals are filled. Oregon getting to a point where we're about to reach capacity in ICU beds. And there are some cases among people that are fully vaccinated for a plethora of reasons. This is what we call, if you heard the term, vaccine breakthrough case. And so if you look at the totality of the pandemic, that's about less than 1% of people who are vaccinated actually test positive. And the big thing that these vaccines are trying to do at this point is protect life. The vaccines help with keeping you alive so you won't die from COVID, even a Delta variant. Helps with keeping people out of the hospital so that you can, live healthy, don't have to worry about being intubated or anything of that nature. So at times there's no such thing as 100%. I know everybody try to say, perfection is the goal. No, to me, improvement is the goal because perfection is not realistic. There could be times where someone is fully vaccinated and due to the increased viral load, if you're around other people who are sick, there is a chance that even if you're fully vaccinated, you can become ill and you can transmit to others. So lower chance versus vaccinated versus unvaccinated. But once again, no such thing as 100%, but it does provide protection of life, no death, no hospitalizations. So what we're starting to see, like, as you remember, if you can remember, the long-term care facility absolutely devastated, and it's still getting devastated to this day, but a lot of people are getting vaccinated. Um, so there could be lower vaccine effectiveness because what the vaccine is trying to do, in simplest terms, is increase your protection. They call these antibody titers. The higher your titer, the more protection. The way I look at it, say you're vaccinated. I like sports, right? And I'm playing a basketball game, right? And it's me and my family against like one person. That's how vaccine, you get a whole lot of people. You're going to dunk on people. You're going to hit three. One person can't stop 100. But the other way around, like say COVID's on the other team. If there's no protection, then COVID may bring 1,000 viral particles versus one, and then you get overwhelmed. So just a little basketball analogy. I like basketball. Sorry about that. I digress. So there are increased hospitalizations amongst youth. And that's the scary thing because 10% of the population are young people, 11 and younger. There is no vaccine. It's thought that it may be available sometime in the fall or early winter. But the reality is trying to get 10% of your population vaccinated and during a pandemic is not going to be something done overnight. So, the Delta variant is attacking everyone. The pediatric hospitalizations are increasing. Long COVID is still something that's not known. There are people who were infected with COVID, recovered, and like a month or so later, they develop chronic diseases. COVID is becoming a chronic disease, unfortunately. So still learning more about the Delta variant, but they call it biological plausibility. It makes sense that if you get exposed to a more transmissible virus, there's a higher likelihood that it can become a chronic condition. And that's chronic conditions being shortness of breath, headache, fatigue. Still being studied, still learning, but that is a possibility. So equity concerns, everything that we do in life has equity implications, just the way our society is. So there are racial disparities among hospitalizations, also death disparities. What we're seeing is our Black community members, our Latinx community members are being hospitalized at a higher rate than others in the population. And also something that's goes into equity. When you talk about wording, how you say things, how you communicate, are you being equity minded? Are you being kind? Are you trying to truly support others? You may hear people say things like, it's a pandemic of the unvaccinated, scapegoating. It's harmful, as we saw, with the way people of Asian descent were being treated unjustly. Um, Depending on the, like I say, 10% of the population can't be vaccinated. And it is true that people who are not vaccinated are hospitalized, they are dying. But you can't discount, that's what equity is, making sure everybody has access to live a healthy life, something that's respectful for them, their culture. That's what health equity is. And if you have 10% of your population who really can't get vaccinated, is it truly a pandemic of the unvaccinated when there's equity concerns there? And saying like your health is in your hands, like it's your personal choice, there's been generational barriers and trauma and discrimination that purposely harm people. And picture this, somebody you think you trust and they stab you in the back every single day for years. You think someone is going to be so willing to go run for help when for centuries they have been no help? There's actually been more harm than help. So health is in your hands. One of the biggest factors of determining health is um, where you live, when you're born. In Louisiana, the death rate in some of the neighborhoods I was from is like, you'll be lucky to live to 25 or 30. You live to 40, like I'm 36. That's a blessing to me. That's why life is so precious because there's so many ways that your life can be taken. So health is in your hands is not accurate. Health should be collaborative. Health should be something that we cherish, something that we truly promote for all people. That's what equity is, and that's a battle that's going to be ongoing. And I'm glad I'm on the side of even trying to promote health equity, because discrimination, racism, anytime you had a problem before, when a crisis occurs, that problem worsens. It's not like you close your eyes and they go away or you can ignore it. If something has never been helped or never supported for centuries, it gets worsened during a pandemic. And that's what we're experiencing right here, unfortunately. Getting back to some graphs, this is the racial disparities that we're seeing so far during the pandemic. As you can see, non-Hispanic Black has been one of the top, unfortunately, one of the top ones that are being impacted. And COVID is disabling, it's disruptive, but you can't take away the history. You can't take away the historical treatment of people. That's why we have these disparities to begin with. And once again, once you go to a pandemic or any type of disaster, those people who are more vulnerable to begin with tend to be impacted at a worse level than others. So this gets back to the point, another health equity. This is data. They used to collect this until March. They moved this data over, but I like this chart because it's informative. It was just about information sharing, giving people more insight so they can make a more informed decision. And once again, so our Black community members are dying at a disproportionately high rate. This was back about 73,000 Black lives have been lost due to the pandemic. And there was data on CDC. Don't quote me on the data, epidemiologist. You can't expect me to be a calculator. But they say like 1 out of 4 Black Americans either know somebody who had COVID or they know someone who died from COVID. And it gets back to systematic disparities that we see in our nation. So this from Oregon Health Authority. It's a good graphic. What they're trying to see is like the vaccine, because there's inequities in vaccines too, for a lot of reasons. Everything, like I say, if you live life, the reality is you're either promoting equity, or if you are on the fence about it, you are on the other side. So once again, there are disparities here. This is looking at vaccine rates. And there are people who would love to get a vaccine if they have the right information, but you got to take into account the the how close is the vaccine? Like, what type of work do they do? Most people, really communities of color, are working what they call essential jobs, right? These jobs that help society flourish, but at the same time, they put people at a disproportionately high risk for COVID. just based on living every day. You're at a higher risk simply for existing. And that's what inequities are. And that's why we're trying to do the best we can to offer vaccines for everybody. Or, if you're on the fence about vaccine, offer information. Because the reality is, uh, I had this happen personally in my life, family members that have died who never had even a choice to get vaccinated, but there is a choice now. And, like I say, this isn't about trying to sway someone. I respect people's decision. I respect people's cultures. Do what you think is absolutely best for you and your family, but do it in a way that's safe. Do it in a way that's respectful to you. Because one other thing that you can't discount during this pandemic is inequities in clinical care, medical care. For generation, almost any surgical procedure that you can think of, slaves were experimented on, and that type of pain. I mean, it just, that type of pain, it hurts, like on a level. Like everything about your life is pain. You understand how hard it is to trust society, how to trust people, or to go get a vaccine when everything you know in life is pain. And that's why I do the absolute best I can. And I don't apologize for getting emotional. Because I have family members that died from this. Whatever you can do that's respectful to you, respectful to your family, you do that and make sure you do it in a way that protects you, protects others. Get to a point where it's about community. Because what we're trying to do is spread health. And where there's health, there's prosperity. Where there's equity, there's love. All this hatred in the world. Let's try to not spread COVID. Let's try not to spread hate. Let's spread love and health. So this is what this is about. So this right here is going to get you where we are in Oregon. So these case rates, right, they have increased substantially. Like in June, almost everybody in Oregon was like in low, right? Now, if you check this graph, like even right now, everything is in the red. Almost every county in Oregon has high transmission rates. And once again, what that means is if you have 100 cases per 100,000, that's exactly what's happening. COVID is once again causing disruptions, causing deaths, and that we can prevent it. I mean, we absolutely can prevent it and lessen these deaths, but it's going to take a global effort, a state effort, a county effort, a community effort to get there. And it's not easy work by no means. So let's talk about something good, right? Let's get some positivity here. You can cry, you can get mad, but let's spin this and let's spare some hope, right? So the vaccines do protect well against this Delta variant, and people that are vaccinated are far less likely to be infected and even spread the virus. And masking, and so there's been another state mask mandate. I'm not here to talk about how you feel on a political level, any of that, but masking truly can help. It's thought to reduce the spread of COVID by up to 70%. So, like I said, there is help, there is hope, but at the same time, if you're dealing with a challenge, a problem, you got to make some effort. Things like this don't go away on their own. So, the next steps, and that's why one of the mask mandates were in place, trying to protect life. So, community transmission is going to increase. If you don't do anything, like you have a problem, it exacerbates if you don't do anything to try to counter the problem that's occurring. So the universal masking is coming back, and once again, this is not just one study. It's been several studies done by the CDC, and they're available publicly on their website that's showing that just simply masking can help prevent transmission for people who are not vaccinated and people who are vaccinated. And at the same time, it's not just one thing, right? You have a complex problem. It has to be a multifaceted approach in order to prevent it. So what that means is you're going to have to good hand hygiene, distancing as best as possible, masking, vaccination, anything that we can potentially do to help protect life. That's what we're about. So there is a mask mandate that's been recommended by CDC, OHA. The governor's putting the mask mandate back in starting tomorrow. And even before that mandate, any building that you went into that associated either Benton County or the city of Corvallis required indoor masking. So like I say, it's about prevention. And the biggest thing, once again, what this is about, we don't want to spread COVID. We want to spread health. We want to spread love. We want to spread equity. And whatever that means for you and your family on a personal level, self-care is so important during trying times. Whatever you have to do that's positive. I'm not trying to brag, but I do like 100 push-ups a day because it's so stressful living life, right? A run, whatever you have to do to make sure that you're healthy, and not just physically. Health is holistic. Your mental health, your physical health, your emotional health, your spiritual health, all that is connected, whether you want to believe it or not. If your mental health starts to go, your physical health go. But if your mental health is up, everything else can improve. It's not about being perfect every single day. It's about making improvements. It's about finding some positivity during negative times, some light in the darkness per se, and enjoying your life and being as healthy as you can each and every day. So take care of yourselves, and thank you for listening. Happy to take any questions, or if you want to make a comment, feel free. Everyone's learning here, and thank you again for your time and welcome me here today to present. I appreciate you, and I wish you all the very best of health. So thank you.
Mm, thank you. Can we give Dr. Dyer a round of applause? Wow. Wow, wow, wow.
Thank you. Thank you.
Gerald, I have a question.
Go for it.
Yeah, one of the things that is concerning with this Delta variant, I'm concerned that we're going to go back to the way things were. And I know in the fall, OSU's talking about having athletics in full stadiums. And
Yes.
I just cannot see that happening. I work security for this fall. And my concern is if I'm in a packed stadium, even if I'm masked and it's full capacity, there are going to be a lot of exposures of the virus, and any one of those individuals in that stadium could spread it to all those people into our community. Have they talked about
John,
social distancing or anything like that?
John, excuse me, John. What's your question? Just get to the question.
My question is are we going to go back to what we had before when when the governor tightened things down basically and said we're no large gatherings or anything like that? Has there been discussions about changing back to the thing and businesses not having indoor dining and all that?
Gotcha.
That's my question, I guess.
Okay,
Yeah.
thanks, John. Go ahead.
So that is a question. I think that's a good question for your local political representative. I think, and quite honest, you have gatherings and people aren't vaccinated, it's going to elevate your risk. But I think that's going to be a good question to ask your local representative and also the governor's office. I could speak to it, but the reality is, when you look at the structure of Oregon, if the governor decides to make that move, I think we're going to follow the recommendation, because what happens is they make what they call, you probably heard of this, Oregon Administrative Rule or Oregon Revised Statute, and these could be executive orders. And once that is made, then there will be no indoor dining, or there could potentially be no packed football stadium. But at this time, that hasn't been made. So as of today, dining indoors is going to occur with the mask. As of today, the football stadium potentially can be packed. If the game was tomorrow, it'll be packed. Now, what happens between now and the kickoff, I have no idea. I can't read the future, but if that does occur, and for whatever reason, the best thing you can do is protect yourself as best as possible, because I have no idea what's going to occur on a daily basis, let alone like a month from now.
Yeah, that's a great question. And we actually have several commissioners that are part of our membership, including Gerald also as a member. But here from Commissioner Zan, the governor has shifted most of the responsibility to local public health authority, i.e. the Board of Commissioners, right? And so again, this isn't a moment for a political ploy, but we do have a political action committee for a reason. That's why we talk and we try to get as many people registered to vote, right? And so again, hearing from Gerald, John, great question. At the local level, okay, Corvallis, Linn, Benton counties, you know, they are the leaders from that space will be the ones that will sort of provide further direction. Any other questions? Let's put them in the chat. Gerald, this was awesome. Oh my word, this is awesome.
Hey, thank you for having me.
Yeah.
I appreciate it.
Yes. Let's see, any other questions coming in? Again, we will, okay, here we go. I think the healthcare worker stories from Florida and LA are heartbreaking. Anything we can do. So Joe, the question is, do you have a sense of how Linn and Benton County's healthcare workers can do a better job in terms of getting the messages out there, getting folk vaccinated? What can we do? Well, health folk, yeah.
So the healthcare workers?
Yeah.
Man, so they do have numbers you can call to get more information. You know, it's kind of hard, you know, because I'm representing like Benton County. I can't, you know, I can't go tell Samaritan, hey, you better put up this poster and tell people about COVID. But there has been a ORA, well, Organ Administrative Rule or OAR that's been implemented. And so what that administrative rule is going to be is targeted at hospitals. It's meant to try to protect not only hospital staff, but also it's meant to protect like patients. Because when you go into a hospital setting with this COVID patient, there's a good chance, even if you go into that hospital, even if it's for something unrelated to COVID, you can potentially be exposed. So there is a administrative rule that's going to go into effect September 30th. I think it's along the lines of either someone has to be vaccinated or prove that they are vaccinated, or it's going to be you're going to be subjugated to like weekly testing of the hospital staff. So if you have a primary care physician per se, and you have questions about COVID or the variant, you can reach out there. Um, Local Benton County, you know, we do have a health service representative that can direct you to someone to give you more information. Benton County has a COVID line. Samaritan has a COVID line. So I think the information is there. It's really going to be a matter of how you're comfortable accessing the information. So if you are one who would rather go online to look, it's there. If you would rather talk to somebody at a clinic, they do have phone numbers available. I don't know them off the top of my head, but they are there. So let me see. I think I wrote that. So yeah, like I think healthcare storage. Oh, anything we could do. Oh, see, I thought you were talking about anything that you could get from the healthcare. Let me read. Let me look at the chat. I'm just looking. Thank you, Jill.
Sorry for confusion.
Oh yeah, yeah.
Really,
So
how can we support them?
oh God. Okay, I see what you're saying. So you know the biggest support that was happening last year that the healthcare workers were running out of what they call personal protective equipment (PPE), but that's adequately supplied at this time. But if you ever hear of a shortage of masks again or anything of that nature, then that helps. And I mean, you all are a community organization that supports people. Just the work that you do on a daily basis helps because we're all connected in some way, whether that's directly or indirectly. The support that you provide in the community is going to have a positive impact, whether that's at the hospital, whether that's in the schools, whether that's in the restaurants. So I think the best thing that you can do is anything that you're doing that's already positive, continue to do so. Because you know everybody has limited capacity, a limited time to do things, but you're already doing something that's supporting people. I say continue to do it because once you start to shift a little bit, then the thing that you've been doing that you're good at that goes away. So anything that you're doing to already support the community, I would say continue to do so and do so as safely as you possibly can. And if there is word that hospitals are running out of PPE or anything like that, then that's always donations that can be made to hospitals. Hopefully we don't get to that point, but if we do, or if we head to that point, please check like Samaritan websites, Benton County's websites, because there's always room to donate and give, even if that's donating and giving to a neighbor or someone who is less fortunate than you. That's how we help each other. If you can do something on a county level, a state level, a global level, great. But helping the person that's right in front of you has ramification that impacts all the populations.
Mhm. Gerald, we're going to take two more questions, and I don't know if you have a hard stop at 8 o'clock, but if you could, if you have time to stick with us, we can kind of have an after meeting kind of conversation with you if you have time.
Oh yeah, it just depends on when my kids need me. So yeah, I can stay to 8. I'll do that for you.
Okay,
No
cool.
worries.
All right, so I'm gonna take these last two, and then we're gonna shift and pivot a little bit from our agenda. This is great, and we are an organization that first of all centers Blackness, right? And so our aim is to always support Black people and people of color. So yes, thank you. Any suggestions for schools? The schools getting ready to go back, specifically preschools and elementary schools. Any suggestions for the school system?
Oh, suggestions such as, so we've been talking to the school board for months. It's gonna be challenging, right? Because the biggest thing is that the younger kids, the elementary schools in particular, there is no vaccination, and if COVID can spread like chicken pox, then if there is a case in their classroom or in their school, it's going to be very difficult to keep their classroom going. We may have to shift to distance learning at some point, but I'll give you what we're hearing from an epidemiological perspective. So epidemiologically, what's going to happen is there's 2 cases associated with a school, and 2 cases, they can be a confirmed case or presumptive case. It doesn't matter what grade they're in. They're in it's high school, or if it's elementary. If it's 2 cases, that's what we consider an outbreak. And so with an outbreak, I know you heard of contact tracing. We do like investigations. We do outbreak support, outbreak response. So, if that happens and it occurs, and the guidance for the schools, I don't know if I could share it with you, because they have something called Ready School Safe Learners. It's like a 45-page document. I'm sure you all have time to read it. But what that document says, this is how it's going to work in the schools. If somebody's within, the current guidance for being what they call a close contact, someone exposed to COVID, if you're within 6 feet of someone for at least 15 minutes, cumulative, doing what they call the period of communicability. And what that period is, that's basically they're sick, they can get you sick. That's all it is. It's a fancy way of saying someone's sick and they can get you sick. And once that occurs, and in the classroom, the exception is if it's kid to kid. So if there's a young kid in there who's COVID positive, whether they vaccinated or not. Unfortunately, elementary schools, they're not. If they're around another kid within 3 feet of that kid, if they've been like greater than 3 feet for 15 minutes or more, that's not going to be considered an exposure, because the thought is you try to keep the kids in classroom as best you can. Now, that kid that gets COVID positive is going to have to be out for what we call an isolation period. That's 10 days from when their symptoms start. If they're asymptomatic, 10 days from their lab collection date. So the other side of that is if a teacher is positive, there is no exception. If a teacher's positive and that teacher potentially transmitting to other kids, it goes back to that 6 feet, 15-minute rule. And so the hope is with masking in the schools and with other mitigation measures, good hand hygiene, trying to distance as best as can. It's going to be hard because we already know the classrooms have been overcrowded for years. And now all of a sudden not going to be overcrowded, so it's going to be difficult. So kid to kid, it's exception 3 feet. If it's a teacher that's positive, or a volunteer, or a substitute, any adult basically in the classroom, if they're positive, it goes back to 6 feet 15. And what that's going to mean is anyone who's within that exposure radius is going to have to be in a 14-day quarantine situation. So there is hope that it can occur. But from the communicable disease perspective, once it occurs, 1 case is more than enough to be disruptive. There have been schools in Louisiana, and Georgia and Arizona who started school, and after a week, they went back to remote learning. Not saying it's going to happen. Nobody can predict how it's going to happen, or nobody can predict the future. But that's the current guidance for schools thus far. And we've been working with a school board as best we can. We have a team that they call Healthy Communities. Been communicating with school board like every week. And so you can have the best laid plan, but once there's a case in the school, how well you won't know how well your plan is until you have to use it. So hopefully we won't have to use it too much, but the way the Delta variant is spreading, and with the increase in pediatric cases, pediatric hospitalizations, more than likely at some point they're going to be and exposure in the school, just being realistic about it.
Yeah, yeah. Okay, then the last question, then we're gonna move on, and then you hopefully you can stick around with us. If you have to bring the kids, that's fine.
Thank you.
Yeah. Is the CDC still recommending double masking?
Double masking. So double masking is an interesting phenomenon, right? Because what you really want is a mask that's well fitting and sealed. So you have two masks, and one's right here and one's right here.
Yeah.
It doesn't matter, right? So what you're really trying to do is get the sealant. You want to be able to get a mask. KN95s are pretty good. I don't know if you ever heard of KN95s, but you know, they actually have a seal. And if they fit your face pretty well, that's really what you're looking for. You want a good sealant, a mask that fits you and it's sealant. Because you have two masks, and you know, it's like, you know, air is flowing in here, or when you breathe, your glasses fogged up. You can have like 10 masks, but if they don't fit well, it's not going to offer you 10 levels of protection. It's really about having something that's well fitted. And that's the best protection you can have, something well fitted.
Dr. Dyer, thank you so much. It's been a pleasure. I'm speaking to existence, brother. You got this. It's been a pleasure. It's been an honor. And if again, please stick around with us. We'll have a sort of after the meeting conversation, because I know we have a lot of questions, specific questions. And so again, just thank you so much for being a very active member in our community, for being a Black man, a Black leader in our community, and someone that we can all aspire to and listen to and learn from. And you kept it real. So thank you so much.
Thank you all for having me. And you know, once again, about life. Life is precious, and I wish you all not only the greatest of health. If I don't ever see you again or hear from you, I hope you have a blessed life. So thank you again for having me.